Hey, I'm Dr. Nuwa, and in the next 3 minutes, I'm giving you everything you need to know about cardiac embryology for USMLE. Let's move fast. The heart is beating by week 4. Everything in the adult heart traces back to an embryonic structure. Sinus venosus becomes your coronary sinus and posterior right atrium. Common cardinal veins become the SVC. Umbilical vein becomes ligamentum teres hepatis. Vitelline veins feed the portal system. Truncus arteriosus splits into your ascending aorta and pulmonary trunk. Bulbus cordis becomes the smooth outflow of both ventricles. And endocardial cushions build your valves and the membranous interventricular septum, which is exactly where most VSDs happen. To remember the order, some cry until vomit turns purple-blue extremes. Done. Atrial septation, 3 steps. Septum primum grows down, leaving a gap at the bottom called foramen primum. Then septum secundum grows inside it, creating an overlap gap, the foramen ovale. At birth, pulmonary resistance drops, left atrial pressure rises, flap closes. If it doesn't close, that's a patent foramen ovale, usually silent but the classic culprit behind cryptogenic stroke in a young patient with no risk factors. Paradoxical embolism. ASD secundum is the most common and isolated. ASD primum almost always comes with other defects. Aortic arches, the two you must know cold. Arch 4 left becomes the aortic arch. Pathology, coarctation of the aorta. Arch 6 left becomes the ductus arteriosus. Pathology, patent ductus arteriosus. Everything else, Arch 1 maxillary, Arch 2 stapedial, Arch 3 carotid, Arch 4 right subclavian, is supporting detail, Truncus arteriosus. Neural crest cells migrate in and partition it through a spiral. Partial failure gives you persistent Truncus arteriosus, mixed blood, and the classic association is DiGeorge syndrome, 22q11 deletion. Remember catch-22, cardiac defects, abnormal facies, thymic aplasia, cleft palate, hypocalcemia. Complete failure of that spiral gives you transposition of the great arteries. Right ventricle pumps to the aorta, left ventricle pumps to the lungs, 2 parallel circuits, incompatible with life without mixing. Classic association, maternal diabetes. Last one, branchial apparatus. 5 arches, 5 nerves. Arch 1 runs on CN5, builds the muscles of mastication. Meckel's cartilage gives you the mandible, malleus, and incus. Classic, Treacher-Collins. Arch 2 is CN7. Facial expression, stapedius. Reichert's cartilage builds the stapes. Arch 3 is CN9, stylopharyngeus only. Arch 4 is CN10, superior laryngeal, cricothyroid, superior thyroid cartilage. Arch 6 is CN10, recurrent laryngeal, all other intrinsic larynx muscles. And for pouches, 3rd pouch gives inferior parathyroid and thymus, 4th pouch gives superior parathyroid and the C cells of the thyroid. That's cardiac embryology. Slides are linked below. Download them, review them, share them with your study group. I'm Dr. Nuwa. See you in the next one.